Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
which of the following is not an adrenergic neuron blocking agent? Reserpine, guanethidine, and bretylium are adrenergic neuron blocking agent. Minoxidil is not an adrenergic neuron blocking agent. Which of the following has favorable effect on lipid metabolism? Clonidine has favorable effect on lipid metabolism. Choice of antihypertensive medication depends upon the comorbid illness of the patient, and all of the following recommendations have been made except in hypertensive patients with heart failure. ACE inhibitors may be preferred. Yes. A hypertensive patient with migraine, beta blockers are excellent choice. True, because beta blockers can be used in migraine, also has prophylaxis of migraine. In hypertensive patients with gout, diuretics are particularly useful. No, actually diuretics are not useful in gout patients. If there is gout, actually ACE inhibitors are preferred. In hypertensive patients with peripheral vascular disease, calcium channel blockers are recommended. True. So this is false. So if you see, if in a patient with congestive heart failure and left ventricular systolic dysfunction, ACE inhibitors are preferred. In a patient with migraine, calcium channel blockers are drug of choice, but beta blockers are also effective. In a hypertensive patient with gout, peripheral vascular disease, diabetes mellitus, post-MI, hyperlipidemia, in this ACE inhibitors are preferred. Hypertensive patients with Raynaud's phenomenon and other peripheral vascular diseases and migraine, calcium channel blockers are preferred. The diuretics like thiazide diuretics and furosemide is contraindicated in patients with hyperuricemia.
thank you and thank you for watching.